for us to do the surveillance. So how do we identify cases? We talked about having to identify case. So how do you identify a case? So you only identify a case that meets your surveillance system by coming up with a case definition. So what is this case definition? So a case definition is a uniformly applied set of criteria for deciding whether to classify a person as having a particular disease, injury, or other health-related condition. So the case definitions helps you out to filter what you want to look at, or what you want to survey, or what you want to collect data about in that particular area. So when we talk of surveillance, you cannot leave out the issues of case definition. So a case definition is a uniformly applied set of criteria for deciding whether to classify a person as having a particular disease, injury, or other health-related condition. So in terms of case definition, I can just borrow a lot during the COVID-19 outbreak. We saw that initially when we had an COVID-19 outbreak in China, the Ministry of Health came up with a case definition, working case definition, whereby they talked about if you see any person presenting with fever, cough, difficulty in breathing, with a history of travel from China, okay? So that was a case definition. So at least for the case definition, we have, I know that we have, majority of us have interacted with it, and we got more exposure during the COVID-19 pandemic. Then in this case definition, usually it has two, in its structure, we have two items that we should not miss. First of all, is that the case definition should have the clinical criteria. Then we should also have the epidemiological criteria, especially during outbreaks. So what are these clinical criteria that should be there in this case definition? So the case definition, first of all, should have the symptoms that you are interested in. So I gave out an example of COVID-19 case definition, whereby we talked about fever, cough, difficulty in breathing. So these were the clinical criteria that we are looking at. Then it should also have the lab data if it's there. It can then on the epidemiological criteria, we can look at time, place, and person. So when we talk of time, during the initial time of COVID-19, I will still dwell on COVID-19. During that particular time, we had a time whereby we said that a person presenting with this and had a history of travel from China between this date and this date. So that was epidemiological criteria that was coming in. Then we talk of place. We had China. Then so that's how you come up with a case definition. So why should we need a case definition? Yes, we talked about case definition, but why should we have the case definition? Why do we need a case definition? So we need to come up with a case definition simply because it helps us to create uniformity. It helps us to create uniformity. If we leave it open, if we just say that we need to have investigations or to do surveillance you need to do surveillance, you will get a lot of cases or a lot of data which might not be relevant to your objectives. So these case definitions help us to create uniformity. For example, for now, the Kenya, we have what we call the IDSR, that is the Integrated Disease Surveillance and Response Technical Guide. It has case definitions for almost all the priority diseases, in Kenya. So in this, it helps us in uniformity of reporting. The same conditions that are being looked in Mombasa, they're the same ones that are being the clinician in Wajir or in the rural areas of Kenya that you can think of. They use the same to identify cases or to identify the priority diseases. Also, it allows us comparison. It allows comparison between different geographical regions. Like for now, when we look at analysis for those who are interested with the epidata, when you go to the WHO website, you can see that it talks about Africa. They have been reporting these suspected cases versus Europe. So why are we comparing that? It's because we have case definitions. Also, it allows comparison over time. Like the case definition should be standard, whereby you can, even after a particular period of time, unless the disease changes, but after a particular period of time, you can be able to compare what you have seen in 2019 versus what you have seen in 2030. So the type of case definitions, we have the surveillance case definitions for healthcare workers, like I've said, the standard case definition. For example, the AFP, that is acute flaccid paralysis, we talk of any child below 15 years presenting with a sudden onset of weakness of the limbs. So that's a standard case definition that's cut across in the entire region. Then we have what we call as the case definition for community health care workers, or we call it as a lay case definition. Let's still look at AFP. For the lay case definitions for the CHPs, we talk of any child below 50, any child presenting with body weakness. So when we look at it, for the standard case definition for healthcare workers, it's more detailed compared to the layman case definition, simply because for the healthcare workers, the more they help us to identify the particular diseases. I mean, we increase our sensitivity for this disease that we're trying to have surveillance about. So how do you use the standard case definition? As a healthcare worker, how do you use the standard case definitions? As I've said it earlier, we have the IDSR technical guide, whereby we have a lot of case definitions for the 48 diseases, priority diseases in Kenya. And in each particular case definitions, this is what you need to do, or you need to apply you need to use this case definition to help achieve this. When you see a patient who comes in the consultation room, you need to ask about symptoms and duration of this disease that they are being reporting. Then you conduct physical examination, record finding on OPD cards, make diagnosis based on signs and symptoms, match signs and symptoms with that of the case definitions. So assuming we talk of an example of AFP, you have a child who comes with who report that you have seen a child at your consultation room, and this child tells you that, or the mother tells you that my child has a body weakness. So as a healthcare worker, you need to ask about the signs and symptoms and duration. So let's say this child tells you that, this mother tells you that this person had ameamka tu asubuhi, or we can say that this child out of nowhere, we have seen this child he has started to develop weakness of the hand. So as a clinician, you need to examine and investigate further. Why is this weakness, or what is there any other condition that caused this weakness? So if you do further investigation and you ask the child what happened, maybe the child tells you that during when I was playing with my colleagues, I fell down and I broke my arm or my hand. So to you, using the case definition that you know for AFP, definitely you say that this is not an AFP case. Why? Because the weakness that you have seen, it's not sudden, and it's I mean, the weakness that we are seeing, yes, it's sudden, but it has been caused by injury. So that's how you use the case definition to know if this case qualifies to be your case or not. So in the community disease case reporting, whereby the community healthcare workers visit the designated household, they inquire about members of the family who came sick, inquire about symptoms, and whichever symptoms that they match what they have for the lay case definition, that's when they report it to CHU. The CHU report to the surveillance coordinator, and the surveillance coordinator does the investigation. So that's how we do surveillance in both community and health facilities. The levels of case definitions, there are three. We have a suspected case, probable case, and confirmed case. So when we talk of a suspected case, we say that this is a person who meets clinical criteria for the case definition. When we talk about probable case, we say that this is a suspected case which is epidemiologically linked to a lab confirmed case. And for a confirmed case, we say that this is a case that has a probable, this is a suspected or probable case with a positive lab results. So the three tiers for case definitions are suspected case, probable case, and confirmed case. Suspected, it only meets the case definition. Probable, this case has a link to a lab confirmed case. For example, when we talk of measles, for the probable case, we can have someone who presents with a fever, rash with the 3 C's, and who is linked to a positive measles case. So if we have such, we say this is a probable case. For a confirmed case, that means the case you have collected samples, tested it, and confirmed that yes, it has the measles. This case is a measles confirmed case. So generally, that's a pictorial on how we use the case definitions. So the first side there, we have the population or people or the cases that come to the hospital or in the community. So using the case definition, you filter out so that you can be able to get you get to get probable cases and confirmed cases. So this is just a pictorial of what we have just discussed. So if you have identified that we have this case, okay, you have applied your case definitions and you say that this meets our case definition for FP. What should you do? So the decision about when and where to report will depend on specific disease and control priorities. We have 48 diseases. I mean, we have 48 priority diseases in Kenya. So for the 48 diseases, we have diseases which need to be reported immediately. So when we talk of immediately, means that this disease need to be reported within 24 hours. For example, cholera. If you have a suspected case of cholera, then you are supposed to report immediately. Why? Because cholera is a disease that is likely, which can cause an outbreak, or it's prone to cause an outbreak. In addition, you also look at this disease, apart from being prone to cause an outbreak. Is it of interest to the national, or is it of interest to the county? And sometimes you can get unusual event that happens in your particular area of jurisdiction. So when you get to see an unusual event, but this event is more likely to cause or to affect human health, then you need to report it. So reporting, it's all depend on issues of specific disease control priorities, the issues of priority list that we have, and also the likelihood for that disease to cause outbreak. So in terms of immediate reporting, we talked about diseases which are prone to disease. Diseases which are prone to outbreaks or which can cause epidemics. If we get such a case, we report it using the case-based reporting, or we have the MYH 542. As soon as you get such a condition which is prone to cause an outbreak, you need to report it within 24 hours. So who are you reporting to? You are supposed to report to the surveillance focal person in your health facility, who can report to the sub-county disease surveillance coordinator. Or if you just have the number for the disease surveillance coordinator, you can just call him or her immediately for them to do the investigations. Okay, so if you are doing the reporting, for case-based reporting, what should you have? What should we contain? Which information is important? So the information which is important for us to do the preliminary investigation for any suspected case that has met your case definition. The information that you should need to collect from the patient is you need to know the geographic and patient location. So when we talk of geographic, we asked about where is this case coming from, like the village, village, county, and etc. Then the patient identification and demographic information, the gender, how can you identify you, like the number, etc. Then the information about onset of symptoms, vaccination history, and information about any relevant risk factors that should also be collected. Then in case you have done lab analysis, we should also collect that and file it during the reporting to the next level. Aggregate reporting, it's good, but however, this aggregating reporting has some limitation. When we talk of aggregate reporting, we can say, like we say, we have reported 5 females who presented with cholera. So it's good, but if we have just the aggregates, it really limits us in terms of analysis and also to identify the risk factors. So aggregate data is usually reported in form of a table